want.
A patient is being abusive to staff.
They're the helpers.
I've been choked with my stethoscope.
Scratched, grabbed,
spit on, stabbed,
had urine thrown in my face.
Getting hurt.
He placed his hands around my neck.
Who's helping them?
It was a nurse that was assaulted.
In a months-long investigation, we interviewed dozens of nurses and other healthcare workers here at home and around the country who've shown us their wounds and broken their silence.
And it's time for it to stop.
Those at nursing conferences around the state say attacks from patients are getting worse, fueled by the opioid crisis, understaffing, and lack of support for complaints.
And we're crying out for help.
What more can we do?
It's a question Lynn Warner-Lynn, Chief Nursing Officer at atefer McDowell Regional Medical Center, asks herself every day since 2 years ago.
Wow, who would have thought someone would have put a phone in a sock and try to use it, to hurt someone?
Since then, she says they've educated staff about reporting violence and taken precautions. For patients who are violent, there are stickers outside their rooms and internal documentation. The letters VR stand for violent risk.
It keeps us more protected.
With panic buttons around the building, more outside lighting, and security, armed with tasers near the entrance.
So just wanted to let you all know that
safety huddles are routine.
We meet every morning at 8:45.
Right now, there are no federal rules requiring employers have violence prevention programs to protect healthcare workers. So many states have passed their own laws. Take, for example, California. In 2014, it passed what's considered the toughest law in the country, requiring healthcare employers to have tailored violence prevention plans with input from staff. This year, Oregon, Illinois, and Nevada also passed laws addressing workplace violence prevention. But many states, including Kentucky and Indiana, have no such laws, so it's up to employers to decide how to protect their workers. In September, the Kentucky Nurses Association anonymously surveyed 177 nurses in the state about workplace violence. 72% of respondents said workplace violence has increased over the past year. 26% said they had never been instructed to report it,
due to fear of retaliation.
Some revealing their employers discourage reporting.
And it's horrible.
It's why Kentucky State Senator John Schickel backed legislation to give healthcare workers more protection. In 2012, Senate Bill 58 made it easier for police officers to take someone into custody, applying only to Kentucky's hospital emergency rooms. In 2017, Senate Bill 42 expanded the law to allow officers to arrest someone when they assault on hospital property.
But I think it's also important that people realize that if you do these kind of things in a hospital, you're going to get hammered.
But lawyer Carl Truman, who represents more and more victims of these attacks,
the frequency has probably doubled and tripled in the past 2 or 3 years.
Says the onus is more on the workplace.
They're going to have to put resources. Resources mean time and money to fix this problem.
We contacted the biggest healthcare systems in Kentucky and Indiana about some of the ways they're responding to these attacks. See that list on WHAS11.com. For Focus, I'm Paula Vasan.